Let's crack on then. And look, I'll try and give you a little bit of an overview of where we're heading with electronic cigarettes or vaping or vaporized nicotine products, which I'll refer to throughout this, this presentation. But just to give you an idea of where we've come from in New Zealand, and we've had perhaps not as good a tobacco control policies as Australia's had, but pretty close behind. But our most recent data from 2021, published last year, showed our daily smoking rates in adults age 15 plus is down to 8%. Be interesting to see when we get some Australian data out very soon where you've moved to. But electronic cigarettes, VMPs, have been on the New Zealand market really since the early sort of 2011, 12 or so, but have quite rapidly increased their market share. And these data from the New Zealand Health Survey just show you if you look at the blue line, the orange line, which is daily smokers, and the yellow line, which is daily vapors, you can see they're right at the same proportion now. So it's been great to see a reduction in smoking prevalence, but at the same time we've seen this increase in daily vaping prevalence. Now, if you're coming from a harm reduction approach, you might say, well, if they're all smokers and they've switched, okay, we'll tackle the harms of vaping later. But just to point out here, these are daily vapors in never smokers. So this is the concerning part of this, that we've got people that have never smoked that are clearly dependent on vaping products if they're using them on a daily basis. And some of those, as I'll show you later, are young people. So just to think about benefits first, and I guess one of the most frequently cited benefits for allowing VMP products is to help people quit smoking. Now, I know that there's still some controversy perhaps about the strength of the evidence. I'm going to show you data from the Cochrane Systematic Review, although this is the network meta-analyses. These data come from a review that I've been involved in for quite some time. But I'll just show you the long-term, 6-month and over follow-up data, taking the most conservative measure of abstinence. And you can see there that VMPs, electronic cigarettes, in terms of how well they might help people quit smoking, moving pretty close to some of our best medicines that we have, or pharmacological treatments that we have for smoking cessation, so varenicline there. These, of course, are not direct comparisons, and Ryan Courtney from med.ndarc will be starting a trial which is a head-to-head comparison of VMPs with varenicline. We're still waiting for the results to be published from a trial he's just completed of VMPs versus nicotine replacement therapy. Now, most of the studies on VMPs for smoking cessation have come from trials that have had quite a bit of behavioural support wrapped around it. And probably the one trial that sways the data the most from a study by Peter Hayek and colleagues that use VMP with face-to-face behavioural support. And so that's often a criticism when you're looking at these data, saying, well, that's fine, they've been used in a way which is in a treatment setting. Matt Carpenter and others published a study this year. It was a naturalistic RCT where they randomised people to receive a 4-week supply of a VMP or not, so they got nothing else. But they didn't get any support apart from a bit of written information on how to use those products, and then off they went and they followed them up. Now the 6-month data here, you can see at the bottom of the table that overall it just sort of scraped in that VMPs were more effective than the control group who got nothing. Just bear in mind this is self-reported 7-day abstinence, so probably on the weaker side of outcome measures. But what interested me here is that for those that had high motivation to quit, there was no significant difference in the use of VMPs. But when you looked at low motivation to quit, suddenly it appeared. Again, there are a number of caveats around this particular trial, but it does make me wonder, is there something about the use of these products in people that have really struggled to quit or, are not so sure about it? Okay, so that's potential benefits. Potential risks. I think there are two main things here. There are, of course, others, but I'll just talk about the two main things, at least in my mind. And one is the uptake among young people who don't smoke and then have ongoing regular use. And then there's the illness and death that might be associated with vaping. And you might say, well, who's died of vaping-related diseases? Well, of course, you do know of poisonings and other things that happen in relation to accidental exposure to these things. Now, back to some New Zealand data, and these are the ASH Year 10 survey data, which a cohort of 14 to 15-year-olds each year gets surveyed. And what you can see here are rates of never smokers, which is nice to see. They're still on an upward trend there. And then the blue line at the bottom, which is the rates of ever tried vaping. So you can see that quite steep increase. It'd be interesting to see this year when we get the data what happened. Is that a true turn of the tide, or is it just a blip at the moment? So we'll have to wait and see. In terms of daily smoking versus daily vaping, overall, daily smokers, going great guns here, down to that 1% mark. But look at that steep increase in daily vaping. Now, again, I think the key question here we need to tease out a bit, is daily smoking among smokers, or is it among never smokers? And what you've seen here, is that there is a 4.3% of users in never smokers. And that's the concerning bit, at least to me. So in terms of uptake of youth and of vaping in young people, we really do have to think quite carefully about this and look at those drivers or risk factors associated with use in young people. And these recent data taken from the PATH study data set in the US show that the top 3 risk factors for youth uptake are the likelihood of using a vaping device if your friend offers it, or your best friend offers it, the number of best friends that you have using these products, and household tobacco usage. So you're surrounded by these sort of people, you're more likely to take that up. So when I'm thinking about what we do to prevent the uptake in young people, our design really has to be influenced by young people. We can't go in there and just say, vaping's bad, don't vape. That ain't going to do it. So we need to think quite carefully and deliberately about this. Of course, the other, so youth uptake, and especially youth uptake in young people who don't smoke, is one risk. I think the other risk is, of course, the health risks. Now, I'm going to caveat this by saying we've got a few more years to run before we start really seeing what might emerge from this. And these data are from a nice umbrella review by Emily Banks and colleagues. Now, most of these findings, it's really just fair to say there's insignificant evidence, but there are some exceptions to this, and one is dependence. There's no doubt that once you can, start using nicotine-containing e-cigarettes, that you can get hooked on these. And then when you go without using them, you get the typical nicotine withdrawal symptoms. In terms of cardiovascular disease, what we do know is that VMP use with nicotine can increase or does increase heart rate and blood pressure. There's also some evidence to show that it affects endothelial function. This is the same with nicotine replacement therapy with heart rate and blood pressure, of course, because that's an effect of nicotine. In terms of cancer, cancer takes years to develop. We're not going to see this. Remember, it took a long time for us to realise that smoking caused cancer. This is going to be the same thing. And similarly, in terms of evidence with respiratory disease, too early to tell yet, but we do have evidence that there are some acute adverse effects on the respiratory system, including effects on spirometry and respiratory resistance. So there are indicators of risk here. So we can't say e-cigarettes are safe. And I think we've all moved away from that, but it's something perhaps in New Zealand where we said e-cigarettes were less harmful than smoking, that we probably got the message not quite right, because we were talking about a comparator in people who smoke. And I think some people heard a slightly different message. Just quickly, there is conclusive evidence on burns and injuries, so these things have exploded in the past. I think it's fair to say that the technology is getting a little bit better. Poisoning occurs, remembering the LD50 for nicotine, somewhere between 6 and 13 milligrams per mil. And then there's the concern over environmental hazard, and these disposable products and the plastic and the batteries ain't good for the environment. In terms of adverse events or less serious adverse events, we see these in the clinical trials. They're really nothing more than we'd see with things like nicotine mouth spray or gum. But it's perhaps not these that we're really that worried about, it's the longer term harm. And again, I think there's enough evidence now to indicate harm. And there are a ton of studies now looking at toxicants in vapor, or aerosol technically. Still less than what you'd see in many cases than smoking. And this is just looking at acrolein with a number of studies, light blue bars from exposure to vaping, darker blue bars in non-use. Of course, you can be exposed to acrolein by eating your overcooked barbecued sausages. But still there are these signals of risk, and this is looking at tobacco-specific nitrosamines. Yes, still less than smoking, but not zero. And some of those studies show more than others. So how do we strike the right balance in all of this? Australia's taken the approach of putting vaping products with nicotine in on prescription. I'm not quite sure that that's working out particularly well with, of course, the under-the-counter sales. People are still accessing them. But we do have some. It's not like we've got nothing in our kits to pull out and use. And I think we do need to start exploring more of these a little bit faster. We're getting better at this in New Zealand. We're starting to look at the regulations and how we tighten up on some of these. At the same time, changing the regulations for smoking. So you probably know that we've got our smoke-free generation plans in place. We're currently reducing our number of retailers from 6,000 to 600, as well as a few other actions underway. But I guess whatever we do, we have to enforce it. There's no use saying, oh yes, we're going to do flavour restrictions, but then you can pop across to another state and you can still get these, or no one's enforcing this. This has been a real difficult time for us over COVID in New Zealand, where all of our public health teams swung round to support the COVID effort and everyone stopped doing compliance activities. So we can't keep lurching from one place to the other. And any of you that are keen on research here, this is one of the key questions that are unanswered. I often hear, flavours are extremely important. This systematic review really couldn't find clear evidence that particular flavours were associated with better outcome. So actually, we probably need to do the studies to say, well, let's just see, does flavour make any difference or not? If it doesn't, then we don't need the thousands of flavours that we've got. Plain packaging, some hints here. Put the packages of vaping products in that awful green colour, and it seems that young people especially turned off by that. So look, I think there is a case for making these vaping products available to people who smoke as a harm reduction approach. I think there's rationale for that. But we've got to balance, that benefit with the risk of uptake in young people. There is evidence for this. And so when you're looking at regulations and other policy measures, that needs to be taken into account. I don't personally think just banning everything it's a very blunt tool, and we're much better we can do much better than that. And just to make a point that regulations need to be adaptable. These devices are changing. What we had on the market 5 years ago, we don't see now. So we've got to make sure we're watertight and being able to change and flex and be adaptable as we go along. And to my last point also, that if you're going to have rules and regulations, you've got to enforce them. Kia ora.